Greet your patient warmly and politely. Identify your patient. Verify the correct patient using two identifiers. Take an oral informed consent. Explain all the steps of the procedure to your patient or family present. Verify audio for manipulation. Check there are no contraindications. Prepare all the equipment on the procedure trolley. Disinfectant solutions. Syringes 10-20 milliliters. Needles. Sterile materials. Container for blood transportation to laboratory. Sterile cotton wool balls. Phlebotomy arm H. Gloves. Personal protective equipment. Apron, medical plastic sleeves, mask, goggles or face shield. Clarify any inconsistencies. Check sterile equipment, dates of exposure, sterilization dates. Prepare the prescription in the laboratory. Record the information in the laboratory logbook. Write the date and time of blood collection, registration number. The same registration number is in the prescription. Check the tube and write a number. This number should be same in the laboratory logbook. Open the cap of the tube. Place the tube into the test tube rack. Perform hand hygiene and apply PPE, personal protective equipment. Open the packaging with cotton balls. Take the package with a syringe from the procedure trolley with your non-dominant hand. Open with your dominant hand from the side of the plunger. Take the syringe in your right hand without completely removing it from the package. Fix the needle hub on the syringe. Take the syringe from the bag with your right hand. Remove the syringe with the needle from the package. Fix the needle with your first and second fingers of the left hand so that the needle cut and the scale are on the syringe barrel are parallel to each other. Check the passability of the needle without removing the cap from the needle. Place the syringe to the left hand. Place the second finger of the needle hub and the other fingers on the barrel of the syringe. And check syringe is working. Displace the air from the syringe, pressing the syringe plunger with the first finger of the right hand. Put the syringe into the package. Position the patient and hyperextend the patient's arm. Place the phlebotomy arm wedge under the patient's arm. Apply tourniquet on the arm over the napkin. Apply tourniquet approximately 7-9 centimeters above the selected site. Closely monitor the arm to ensure that it is not applied too tight or for more than 2 minutes. Reasons for concern would include numbness, change of color of the skin, blue or white, and extreme pain. Ask the patient does not pump the hand. Select palpate venipuncture site. Clean the skin. Ensure that the site for injection is socially clean. Perform hand hygiene and apply gloves. If cleaning is required, soap and water should be used. The first cotton wool ball wide by antiseptic, is used for area 10 to 10 centimeters for disinfection. The second one 5 to 5 centimeters. The direction of cleaning is from periphery to the center. Place cotton wool balls into the waste container. Take the cotton ball with antiseptic in your right hand. Hold it with the fourth and fifth fingers. Take the syringe from the package in your right hand. Place the second finger on the hub of the needle. Other fingers are on the syringe barrel. Remove the needle cap. Check the position of needle. Fix the vein in the venipuncture area with your first finger or non-dominant hand. Grab the patient's arm below side of puncture firmly to draw the skin and enter the vein from rolling. Insert the needle at a 50-degree angle into the vessel. Release the tourniquet. Place the second and third fingers of the left hand on the syringe plunger. Draw the required amount of blood into a syringe. Remove the needle from the patient's arm and press down the vessels with cotton wool ball. Tell your patient to apply pressure during 5 to 10 minutes and don't bend the arm. Place the needle into the tube. Slowly evacuate blood from the syringe to the tube. Don't touch the needle. Close the tube with a cap. Put the needle in the container for sharps contaminated with blood with using of needle cutter. Place the syringe into the waste container for contaminated syringes. Place the needle caps into the plastic waste container. Packages paper will be placed into the container for non-hazardous waste. Prepare transportation container for tubes. Place a tube into this container. Close the container and check the prescription to the laboratory. Deliver blood specimens to the laboratory promptly. Clean the apron, sleeves, face shield with disinfectant. Rinse it with water and dry it. Remove gloves and place in the container for contaminated wastes. Advise patient to rest for 5 minutes and ensure bleeding has stopped before leaving the site of venous blood collection. Perform hand hygiene, register the procedure into the patient chart. Perform hand hygiene and apply gloves.